This is the module on providing human guide for patients who are blind, developed as a training primer intended for Michigan medicine faculty, staff, and volunteers. This training will provide an overview of human guide and helpful hints on making Michigan medicine more accessible for patients who are blind, low vision, or vision impaired. For people who are not in our hospitals every day, navigating Michigan medicine's facilities can be like traveling through a maze, even for patients who are not blind. Patients who are blind, however, face more challenges to visually navigating the hospital. Consider some of the most common types of vision loss and how this would impact how a patient or visitor travels through our facilities. Patients may have an acuity loss, age-related macular degeneration, diabetic retinopathy, or any combination of these and other types of vision loss and other disabilities. Because navigating the hospital can be difficult for people who are blind, the Centers for Medicare and Medicaid Services recommend that hospitals conduct trainings like this one to improve staff readiness to assist patients and visitors who are blind. With a little effort, you can help improve accessibility and care for patients and visitors who are blind. It is important to remember that a blind patient is not necessarily fully blind. In fact, the majority of people who have vision loss are not completely blind. The legal definition of blindness versus low vision is primarily based on vision acuity, which you may know as being described in a form like 20/20, and if that vision loss can be corrected with glasses. Being legally blind means that the person has central vision acuity of 20/100 or less in their better eye with correction. A person's visual field, which refers to the area we can see with our peripheral vision, is also considered. Some of the most common conditions related to vision loss are an acuity loss, age-related macular degeneration, cataracts, diabetic retinopathy, and glaucoma. With these varied causes of vision loss, there are a variety of terms that a person may choose to use to describe their disability and identity. For example, a person may identify as blind, low vision, vision impaired, or having vision loss. The use of the words blind or low vision may not necessarily be aligned with the legal definition of these conditions. Still, you should adopt person-centered language and use the terminology that the patient or visitor uses. If a patient identifies themselves as blind, regardless of if they are legally blind, you should adopt the language they use and try not to force other identifiers on the person. People who are blind may navigate their environment through a number of ways. People who use a white cane, such as the person on the left, receive information about the surface of the ground or changes in the slope or ground type through their cane. A blind patient may also use a guide dog to navigate their environment, as shown here on the right. In addition to these mobility tools, blind people may use any remaining vision they have, in addition to their other senses, such as hearing nearby cars, feeling the difference in temperature between a sunny sidewalk and a covered parking garage. It can also use their sense of touch to feel differences in the ground type. For example, in the photo on the right, the person is able to feel the bumps on the sidewalk's tactile paving, also called truncated domes, through their shoe sole. This lets them know when they are leaving the sidewalk and entering the street. Another navigation technique, and the focus of this training, is human guide. Human guide is when a person guides a person who is blind through their environment. When serving as a human guide, the goal is that both people are moving smoothly and safely through the environment to their destination. In the photo on the right, there are two people. The person with the white cane is holding on to the arm right above the elbow of the other. The human guide signals turns, steps, and doorways through movements of their body and through communication with the blind person. When working as a human guide, it is possible that you may see a guide dog or other service animal. When working with service animals, it is paramount that you do not distract the dog from its work, do not pet the dog, talk to the dog, or intentionally make sounds to distract the dog from working. There are several techniques that a blind person with a guide dog may use when receiving human guide. Some individuals may remain connected to the guide dog's harness and still grab on to the human guide. More commonly in this area, however, a blind person will use the human guide and stop using the guide dog's harness, using the soft leash instead. This lets the dog know that the guiding is someone else's responsibility. This is shown in the photo on the right. Another technique that a blind person may use is that they may direct the guide dog to follow the human guide. In this case, the human guide will walk several paces in front of the guide dog and blind handler, and the guide dog will follow the specific person. When working with a guide dog, be aware that the dog is trained to be intelligently disobedient. If a guide dog is following you and you are crossing an intersection, the guide dog may communicate to the handler that it is or is not safe to cross the street. Do not cross the street and then call the guide dog after you. Again, do not distract service animals when they are working. Over the next few minutes, I'll give you general tips on how to be a human guide. Then we will work through some example scenarios demonstrating best practices. The general setup of human guide when the person who is blind is led by the guide is in the photo on the right. The person being guided will gently grasp the guide's arm, thumb out just above the elbow. When working with blind children, the child will grasp your wrist or hold your hand, depending on the height difference. When walking through the environment, the human guide will walk a half step in front of the person being guided. Before we give you the knowledge on how to serve as a human guide, it is important to remember that you should never begin touching a blind person or impeding their mobility without asking first unless their safety is compromised. Never approach a blind person and grab them or push them. This can be very dangerous, removes a person's autonomy, and can be very jarring. When in doubt, remember to ask me, or in this case, the patient or visitor first. Over the next few minutes, we'll provide tips for providing human guide with two community members, Mark, a person who is blind, and Lori, a certified orientation and mobility specialist. In this video, Mark just arrived for his appointment with his guide dog. He is outside of the building and walking towards the entrance.
Good afternoon.
Hello.
Are you Mark?
Yes, I am.
Hi Mark, I'm Lori. I'm going to be your human guide.
Hi, Lori.
Would you like to take my arm or would you like to follow?
I'll follow.
Excellent. Well, come on in.
Notice how Lori introduces herself as Mark walks up and does not distract the dog or assume how Mark would prefer to be supported. In this case, Mark decided that he wanted to follow Lori with his guide dog. Let's imagine a different scenario where Mark decided to take Lori by the arm. In this video, we'll show how to go through a doorway. Mark has taken Lori by the arm, right above the elbow, and is using a white cane instead of his guide dog. The pair are walking towards a doorway, in this case an entry door, but this could be any door within our facilities. Lori tells Mark that the door opens on the right and will open towards them, and that she will open the door. As Lori opens the door, Mark travels through the door and then Lori gets back into the guiding position. In some cases, however, the doorway may be too narrow. In this situation, the human guide will move their arm to be placed on their lower back while their palm faces outward. This signals to the person being guided that they are entering a narrow doorway, should move their hand from the upper elbow to the wrist, and move their body directly behind the human guide. When you start providing human guide, the goal is to move safely and efficiently through the environment, from point A to point B. In this video, Lori and Mark are outside, but this is the same comfortable pace that should be considered when working in our facilities. Mark is using a white cane and he is gently holding Lori by the arm as she provides human guide on the sidewalk. Notice how the pair are walking at a comfortable pace, making conversation with each other, while Lori provides human guide and Mark continues to receive information through his cane. In some cases, you may need to approach steps. In this video, Lori is guiding Mark while he uses his white cane. They approach the curb directly, not at an angle. Lori tells Mark about the step, and as he approaches, he also receives information from his cane. They then slow as they approach the curb, step up, and continue at a normal pace. When in our facilities, it is not uncommon for patients and visitors to have to use stairs or elevators. In this video, Mark is using his guide dog and following Lori. When guide dogs follow a specific person, the human guide will walk a few paces ahead of the guide dog and the handler. As they approached the stairwell, Lori told Mark that the handrail was on his right. In some cases, the human guide does not use the handrail themselves, but you should do whatever feels most comfortable to you and the person you're working with. As the team goes up the stairs, Mark's hand stays connected to the handrail, providing information about the stair while turning. Lori will then alert Mark when they reach the top. In these next two videos, we'll demonstrate how to provide human guide when entering an elevator. In this case, Mark is using his white cane without his guide dog. Lori has called the elevator, while Mark continues to hold gently onto her arm, right above the elbow. After opening, the pair enters the elevator, turns around, and then Lori pushes the button for the intended floor. Let's look at another video where Mark and his guide dog are following Lori as they approach the elevator. Lori calls the elevator. After the elevator opens, Mark and his guide dog enter the elevator and turn around. During this process, Lori tells Mark that she is following in behind them. Once Mark and his guide dog are in a comfortable position, Lori enters the elevator and selects the floor. The final destination for most of our human guides will be when the patient arrives to the waiting room. In this video, Mark and his guide dog are following Lori into a simulated waiting room.
And here we are in the waiting room. Mark, there are 4 chairs. Would you prefer to sit in the middle or on the end?
On the end, that'd be easier for Doggy.
Okay.
Myself.
Right down here, the last one on your right.
Thank
You have a great day.
you. Thank you.
Notice how Lori explains the available seats to encourage Mark to choose a seat that he prefers, and then guides him and his guide dog to the seat before verbally directing him to the location. In this example, one of the waiting room chairs had items in it. In many cases, there may be other patients. Some blind patients and visitors may prefer to know if there are empty chairs away from people or near the door that clinic staff will call patients from. So let's review. Here are a few takeaways and other tips from this training. Human guide can be provided safely in healthcare environments. Not all blind and low vision patients have experience using human guide, and because of this, we should ask the blind patient or visitor how we can best support them. Lastly, we want to communicate changes in direction, terrain, or entry to ensure that the blind patient or visitor is aware. If you're interested in learning more about different ways to improve accessibility in your clinic setting, check out the Center for Disability Health and Wellness's clinical resource guides at disabilityhealth.med.umich.edu. This project was supported by funding from the University of Michigan's Center for Disability Health and Wellness, a group of researchers, medical providers, and staff dedicated to improving health outcomes among patients with disabilities at Michigan Medicine and across the country. We would like to recognize staff and faculty at Michigan Medicine for supporting this training, in addition to external partners such as the Ann Arbor Center for Independent Living and Leader Dogs for the Blind. And thank you for your support in improving accessibility here at Michigan Medicine.